So if we need to record, there we go, read my mind. Again, thank you everyone so much for being here on a warm, smoky, middle of the week day in July. Thank you again. Really, really appreciate your attendance, committee members, as well as members of the public who make this engine run. We are gonna start right off with roll call. And Ashley, if you could take that away for us.
Good morning, everybody. We'll run through roll really quick. Is Caroline Cruz here today? All right, Debbie, you're here. Pam,
Here.
thank you. Lindy, I think I saw you come in.
I didn't think you were going to be here, Lindy.
I'm gonna have to leave around 11:30.
Okay, thank you so much for squeezing us in.
Great. Shauna,
Here.
thank you. Alexis,
Here.
thank you. Zeb, is Zeb here today? Okay, Amy Muhlenberg. Luis,
Here.
thank you. Timothy Lynch. I see you here. I see you, Tim. I know you're here. All
Tim,
right.
I don't know. Tim, I don't know if your audio is working. Just you might want to double check.
Can you hear me now?
Oh, yep.
Yeah.
Yeah, we can hear you now.
Perfect. Thank you.
Beth? Beth Stormshack
Here.
here?
Yeah, I'm here.
Great, thank you. Martin?
Here.
Thank you. And Jessica Jacks?
Here.
Great. Did I miss anybody? Okay, and we have hit quorum. Back to you, Debbie.
Awesome. Thank you, Ashley. I forgot, apologies to our kind of annual, not annual, every meeting level setting as far as the charge of this group, our definition and what we're doing as far as prevention, the practices, programs, and policies designed to prevent and reduce the incidence and prevalence of alcohol and other drug use and consequent health, behavioral health, and social problems. So that is our big kind of North Star with the work that we do. One thing, well, no, we're going to turn it over to Director Annalise Dolph for updates from the big commission.
From the big commission, which is led by your committee chair, who is now also our commission chair, Debbie, wearing all her different hats. Hello, happy July morning. Annalise Dolph. I'm the director for the Alcohol and Drug Policy Commission. My quick updates from the full commission and other committees. I will note for this committee our biweekly newsletter, which will come out again this Friday. The last one featured Wes. So there's some cutie pictures in there of his family. If you have not checked that out, I'm sure Andreas is going to love that picture someday. Our fearless communications lead, Stephanie Condon, will be back in August. So you just have, I think, a couple more newsletters to bear with us. And then Stephanie will be back to make things look much fancier and up our content. The full commission met earlier this month and we did an update on the first 6 months of the plan. So, and that's also going to be the newsletter this Friday. So if you missed that, we'll summarize it. And the video, of course, is available online. I very naively thought we could get through that quickly, but so much work has been happening with the staff and all the committees that we did take the full 2 hours. So that's exciting, though, that we have that much to report out. Still coming up this month, Health, Safety, and Interventions is meeting. Mara's committee, they are going to be talking about a naloxone toolkit for folks to use to make sure that everyone across the state has kind of all in one place resources on how to get naloxone in the cheapest, most efficient, most effective way. In August, I will give a little preview for that one. Senator Reynolds is going to come to Health and Safety Interventions to talk about her planned legislation for the next session related to syringe service programs. So that might also be of interest to some folks in here. And then the rest of the August meeting will be focused on Save Lives Oregon and some recent surveys and other work that they are doing. Treatment is last month or this month and next month, talking about discharge and transitions. Very exciting. And next month, they'll also be talking about ASAM 4 implementation. Prevention, of course, you all know what you have going on. Recovery and OYA are working together over the next month to hone in on. The recovery committee has developed a uniform definition for recovery community centers in the state. And they've been working with OYA to kind of develop an add-on with some more specific best practices for recovery community centers that serve youth. So that's exciting. Youth, OYA is also prepping for an upcoming youth summit that they will be represented at. We're going to have quite a few OYA on the road moments in the coming months. The youth are in demand. The commission, I forgot to mention, we spent last month coming up to speed on where we're at with the plan. We are taking August off, giving ourselves a little break, and then we'll be back in September to talk about the overall substance use disorder financial assessment that ADPC has completed, and kind of part of that, but also supplementary, is the House Bill 3321 primary prevention assessment that Third Horizon has been doing. So September will be all about where's money going in the state, what are some of our findings and recommendations for that going forward. And then finally, I'll give my monthly opioid settlement board update. The board is meeting in August to share. A group has been meeting to help to advise OHA on the development of a request for grant proposals. Folks will remember the settlement board decided to do one round of one-time funding, offering it up for folks to come in and apply for projects. The intent is to have a minimum amount allocated across the continuum of care. There's a whole bunch more kind of caveats and decisions and how that's going to align with the ADPC plan. So if you're interested in that, the settlement board will be reporting out and providing final recommendations to OHA in August. The plan is to have that RFGA available this fall. OHA is already getting questions and they haven't even posted it yet. So they are starting the FAQ now. So rest assured they'll have webinars and FAQs and all that kinds of things. So check that information out there. And then in ADPC and settlement board kind of connection news, the ADPC has started its own data work group. And the first kind of task for that work group is to work together with the settlement board to make recommendations for how to spend the settlement board funding that is allocated toward a substance use disorder data system. So more to come on that in future months, but there's a wonderful group of folks at OHA and at ADPC who have been working behind the scenes, mapping recovery. Mitch is a part of it and co-leading some of it. And we're pretty excited to move some of that work forward in collaboration with the settlement board. So those are all my updates for today. Does anyone have any questions?
Okay, thank you, Annalise, and we appreciate this opportunity to be a part of the whole continuum and hear what the other groups are doing and the great work that we're all doing. I think even though we talk about upstream in a particular way, all of this is to a certain extent upstream because we're helping, I hope, improve an overall system. So thanks for keeping us in on that. We're gonna turn some time over to Wes for some updates. I did want to share with the group that Darren Dale has taken a new job, and so it doesn't really fit anymore. He was our CCO rep, and time constraints. He wanted to pass on to all of you the appreciation of working with you, and we appreciate Darren as we all kind of started this new journey together, the insight he provided. So wanted to make sure and pass that along. Same, I think we've mentioned Caroline with the new role she's taken on, but I believe Wes will fill us in on the rest as far as committee recruitment updates. Wes.
Yeah, hi everybody. Wanted to give an update around where we hit a point where we had 3.5 transitions happen all at the same time. So that triggered a conversation with Debbie and Luis to do a proactive recruitment. The recruitment for the prevention committee is ongoing, so the link is always live, and we take applications as they come in. It's always rolling. But we're going to do a more proactive recruitment. So I just wanted to show you where these fall, and so to give you some ideas of where to really push the application. Because if, as you remember, when the committee was created, there was a membership committee, a sub work group who really developed a platform by which we wanted representation from all over the state. And so you will see in these seats that were held what we're looking for a little bit. So I'm just gonna show you the prevention roster, and I'll just go through this really quick. Okay. So I do not have Caroline moved out quite yet. We are waiting for some conversations with the tribes to fill that seat at the commission level. Then it will be up to that person whether they want to join the prevention committee. So that position is pending, although we are going to be thinking about that when we do the recruitment in this next round. Darren, as Debbie mentioned, took a job with the Veterans Affairs, and so is moving over and outside of kind of the prevention world, doing treatment stuff. So he was holding the role at the beginning as a constituent of Southern Oregon, as well as his hat of serving as a CCO, behavioral health director, and then moving over to a federally qualified health center director. So we are looking for something in that range around FQHCs and CCOs. I think CCO was the identified need when we talked originally. So I think that's something that we are going to be prioritizing, but we would also really think hard about any representation from a federally qualified health center as well. I will say we really need some Southern Oregon representation in general. And so just note that as you go through this. Amy Zimmerman also needed to step down. And so she was representing early childhood human development in one of those seats. She also wore the hat of an overdose prevention a professional within kind of the structure of the ODPEP. As well as holding a seat in Umatilla County, so Eastern Oregon representation. So again, we need Eastern, Southern Oregon representation. And I think you can think about her positionality broadly. Those weren't named seats when we did those things. So it was more when we got the applications, this was good. It was good to have people from multiple perspectives. So I just wanted to give you that context. Finally, Frankie Hoopy, they are a commissioner, and we're in our legal profession commissioner seat. They had a very strong passion for youth in the criminal justice system and prevention from that lens, and were representing Yamhill County. So they moved on. The new person who took that position within the commission is going to do is more focused on harm reduction and health and safety interventions. So she moved over to health and safety interventions. So this seat can really be anything that you all want it to be. But representing rural Oregon is important, and thinking about how we can get those voices. I will say we only have one representative from the coast currently. Thinking about increasing our coastal representation might be of value for that. So those are the three seats that are open, and then we have this conversation with the tribes that's ongoing for at a commission level. So I wanted to make you all aware of that. I am sending you the application now. I will send an email attached with our usual homework email. So please put that out. HIDA's Prevention Summit is next week. We've got a flyer with a QR code. We're going to be passing those out. If you're there and can, meet somebody new, nudge them over that way, please. And so, as much as we can get this out, that would be amazing. And that is all I have for that update. Any questions around recruitment? Once we get this out, just one, sorry, Debbie, I saw you come on. One more thing, I just want to make a clarification. We'll put this out for about a month. And then once we have a critical mass, I'll get with Debbie and Luis, and we'll come up with a process for going through the applications, which we would include membership from the committee to do that. And we can go into an executive session and make those decisions if we need to. How does that sound to everybody? Debbie, did you have a question? Sorry.
No.
Okay. Thumbs up.
Oh, great. Thanks for staying on top of this for us, Wes.
Yep.
And just as Wes said, encourage you to kind of think outside of your normal, who you see every day, rubbing shoulders with. Think about some of those potential individuals that aren't represented, especially with our coastal Eastern Oregon, Southern Oregon. And maybe you see them in different Zoom events and that. Don't hesitate to say, hey, this is a happening group. You want to be involved in real change, and encourage them to sign up. So, all righty. Now, the bulk of the meeting now is going to focus on, again, our Center of Excellence and Governance. I'm going to turn to Wes for kicking us off on that. I just want to throw out one reminder as we discuss this, is we are not discussing who could do it. We're not even worried about that. So put that out of your mind, and it's again more of the, when we get the dream, how do we want it, the governance, some of those questions that Wes gave us on our homework, but just that level setting, we're not looking at who would do it. So with that, Wes, I'm going to turn it back over to you to get us started with updating on us with the homework. And one more thing, if you didn't get a chance to do your homework, I know things come up, and it's not, as Wes always tells us, hey, sorry, you get a 0, you didn't get it in on time. Continue to reach out. We do got to keep the ship moving, but know that in writing, even a little bit late, will be accepted, and we want everybody to have a chance to really feel like their voice has been heard. So, Wes, thank you.
Yeah, absolutely. You don't get a 0. You just don't make the public meetings law rules of like getting it posted. So that's the only difference between having your homework done right before the meeting or during the meeting or whenever. So it's just,
I am keeping a list, though.
yeah, okay. Okay.
Christmas
Debbie's
goodies
keeping a
will
list.
be determined on.
That's not an official position of the ADPC. Just making sure everybody knows. Right before we get started and get into this governance discussion, I did want to mention one thing related to what Annalise mentioned about kind of the rollout of the financial analysis and the HB 3321 assessment. In August, we will have a drafty draft of the HB 3321 assessment from our friends at Third Horizon. That will go to you all first. And so the ask from Third Horizon is it is a big document, but they really, really, really want your feedback. And so I'm not giving you any new homework this month just for that. I will ask you to think about some of the things we talked about today. We will talk more about those in the coming meetings. But what I really want you to do between now and our next meeting is to really spend some time with that document as much as possible as you can in August. I know it's a big vacation time, but I'm hoping that that can be kind of your sole focus between now and the next meeting. Elvina, is there anything else you wanted to mention with that?
I don't think so, Wes. Thank you for covering that.
Yeah. All right, let's jump in. So today I gave you two big homework questions. Today I really want to focus on the first one. And so I gave you a lot of homework knowing that we were going to have this timing was going to happen with the 3321 assessment. But I really want to focus on this first one, and I really want to hear from every single committee member in this room. You don't have to speak out loud, but if you send me a note, that would be amazing. Because I think this is the most important question for governance, is this first question that we put before you. So I'm going to share my screen and I'm going to give you a little bit of the context and answers from this. Can everybody see this okay? Do I need to go bigger? Can somebody say if I need to go bigger?
Looks good on our end.
Okay, great.
Yeah.
Perfect. My setup's a little different, so I can't tell how big this is. All right, so homework question number 1. Based on the discussion over the last year and a half, it is assumed that the ADPC Prevention Committee would have a significant role in the center's governance. Oversight, which means monitoring and supporting the center to fulfill the intent of HB 3321 and the ADPC Comprehensive Plan. And then advisory. So publicly advising the center on future prioritization concentration, given policy, budgetary, and political context of any given moment. I'll get into a little bit more of what that means in my head and see if that's what you all interpret that to mean in here in a second. Is this the correct assumption? With greater clarity of scope, does ADPC Prevention Committee still see themselves in these support roles? And so really splitting out this oversight and advisory is really important for thinking about how this lands in state government or elsewhere. Advisory is what we do currently with many of our agencies. We have an oversight role, but a lot of the time when we build a comprehensive plan, when we are advising on specific things that a state agency does, that is an advisory role. We are publicly talking about what we would recommend for a state agency or clinician, if on our treatment side, clinicians or preventionists to do. And we make that voice heard and we provide that advice to folks. Oversight is an entirely different beast. That means we are actively holding to account a specific set of standards and purpose for a given entity to do the thing we want them to do. That's one step beyond advisory. And so if you think about in our state, there are multiple advisories versus oversight boards. And oversights tend to be a little bit more, the governance structure is a little bit more strong or strict, I guess, is what you would say. And so what the question is before you is that is quite a feat and so I want everyone to be prepared for what that means, and thinking about how they want to go about the Center of Excellence doing their work and what role the ADPC Prevention Committee wants to have. This is all within the bounds of ADPC statute, so no one needs to worry about like the scope issue here. The other thing that I saw come up in the homework answers is worried about capacity. If it does indeed become a contract, we do have contracting capacity. I am our contract administrator for the agency. We have contracting authority. Mara is going to help me more and more on contracting. So we have people dedicated to doing this type of work. It's if y'all want to do it. And so I think that question is really important, and that's why I want everybody to speak to that a little bit, and whether they think it is appropriate to do so for this committee. So I'm going to go through the answers, and then I would really like to open it up to discussion on that central question. If everybody's like, heck yeah, let's do this, and we get through it fast, we'll move on to the other question. But I'd really like to spend quite a bit of the time today thinking about this and trying to kind of have folks ask questions what this means. If there are, if you need examples, I think folks in this room who have served on advisory and oversight boards can give examples of how this is different, and I can give you some examples of how it's different staffing. I know that at least, and so let's get to it. So I will say overwhelmingly the commentary is positive, and heck yeah, for lack of a better term. I agree the ADPC would serve in the support roles above. The center would likely create a report for the ADPC to review annually, as well as connect with constituents and community to provide guidance on prioritization. I wholeheartedly say yes. Just kind of going to skim these a little bit just so y'all have more time to talk, at least until it's well established and properly operating. You would want to be adequately involved in the oversight for the center's first year or two before stepping back. Yes, 100% support the center to fulfill intent of HB 3321 and HB 2929. HB 2929 is our change to our authorizing statute for the ADPC to include explicitly primary prevention and youth supports specifically. So just to give you a little bit of context for that. Yes, with the passage of HB 2929, the ADPC Prevention Committee's governance role is strengthened. HB 3321 established the framework for Oregon's statewide primary prevention strategy, while HB 2929 strengthens statewide coordination and accountability. So just describing oversight roles, monitor fidelity to statewide primary prevention strategy, ensure COE remains grounded in prevention science, risk protective factors, and strategic prevention framework. Advisory, advice on statewide priorities, policy opportunities, and implementation challenges, review work plans, outcomes, performance measures, provide long-term stewardship. The Center of Excellence should serve as Oregon's North Star primary prevention. And then a bit about some of the roles that we've already identified, as well as statewide strategy developed through 3321. And then just a little bit of other commentary that I wanted to read that's at a higher level. Before considering governance scenarios, I think it is important to view the Center of Excellence as an entrepreneurial implementation organization, not in the business sense, but in the ability to be nimble, innovative, and action-oriented. So there's several things that the center could do that's could be quicker than what the state can do. Governance should provide accountability without creating multiple layers of authority that reduce flexibility or slow down decision makings. Key point there. Long-term success of the Center of Excellence will depend less on organizational home than on whether its governance safeguards its mission, neutrality, accountability, and statewide credibility. Additional governance principles, separate governance from operations, keep the COE mission driven and grounded, strengthen and coordinate existing partners, measure success by implementation and quality, workforce capacity, statewide coordination and outcomes, treat the initial organizational home as an implementation phase with a formal review after 3 to 5 years, promote statewide adoption through funding alignment, and the COE should become Oregon's trusted statewide implementation infrastructure. Okay. So Debbie, you want to help me and we can just call on folks, or let's see what folks' reaction. Are people surprised that there was a lot of strong support for this? What do they think? Beth?
Beth, please. Yep.
Thanks. That was an interesting review. I'm not surprised, but I think I can't remember what I wrote, honestly, but in hearing you discuss it, I think seems clear to me that the ADPC should serve as in an advisory role for sure. I like how you framed the oversight role, Wes, because I do think there's a couple of issues to consider. One, what would it mean to have oversight of it? Is this committee staffed in a way that would allow for that? And this is kind of like the counter question to that. If we didn't have oversight of it, who would? Is the other, I don't know the answer to that. If there's some better oversight, maybe that's great, but I don't know enough or know what that would be. Who would be the oversight if it was not this committee?
Thanks,
That
Beth.
seems like a key question because that could go really wrong for, if it's not the right set of people.
Thank you. Other comments, please. Martin.
Yeah, I would concur that I heard a lot of support for the advisory, some support for the oversight. It seems to me, as I think about this, I would be in favor of us primarily, if not exclusively, serving in the advisory role, because I think if we kind of spread ourselves too thin and we're responsible for the oversight as well as the advisory, I think one is going to kind of take a backseat to the other. I can certainly see that happening at some points where we get too mired down in one and kind of neglect the other. Um, and I think if we're going to be as effective as we can be as a body, I think our energy and kind of drive be toward one of these aspects. It's not to say that so if we were to fully commit ourselves to the advisory part of this, it's not to say that we couldn't meet once or twice a year with the oversight committee just to make sure that, or what are their findings, and is the COE adhering to 3321. But we would be kind of responsible for that guidance and that prioritization of certain things, and being innovative in approaches and things like that. And that's where our energy would be put. So that's my 2 cents.
Thank you, Martin. And maybe why we're getting a few more people thinking. A question I would have, Wes, that just kind of, and maybe you touched on this and I missed it. When we're talking about oversight, I think are we thinking our prevention subcommittee or ADPC as a whole with the staff support that has it?
Yeah, so I would not distinguish those two things. So you would have the institutional capacity of the ADPC while acting as a board, basically.
Okay.
So you could act as an oversight board with that advisory function built in. Staff, myself, Mara, Annalise, we would be responsible for carrying out those things and actively monitoring compliance with generally the oversight mechanism we would use is a contract. And so we would use contractual obligations as our main mechanism for oversight and accountability. And so that would be no different than what we do today. We have contracts, not for something so big, but we actively monitor those for compliance with what we're trying to do. This would be taking the y'all's will, which is generally what we do with contracts anyway. It's just less formal, and making sure that those contracts are adhering to what you want to say or what you want to do.
Thank you. I appreciate that. That gives me kind of more, maybe I think both Beth and Martin kind of brought up a bandwidth concern, so I think that helps understand that. Let's go with Jessica and then Pam, please.
Hi, thanks. I like this direction, and as I'm thinking about the comments, it's bringing to mind our audience, the audience of the Center of Excellence, and that being the primary audience being the local prevention workforce. And so I'm just wanting to us to think about how, as a prevention committee, we intentionally assure that we're getting feedback from our primary audience so that we can adapt and adjust, be really, I know we all want this to work, and we want to know if it's not working. So, what we can do to adapt and adjust. So some intentionality about bringing that voice forward is one thought. And then the other thought is connected to, I'm thinking about how we're like, how do we get the voice of or input from like the Oregon Health Authority, who have funding streams that are going, if our local prevention workforce is being funded to do things a particular way through the Oregon Health Authority, for example, or whatever funding mechanism. How do we assure that connectivity, feedback from funders, but also that there's symmetry and alignment with the messaging that our Oregon funding base is giving? So one example that comes to mind is how the Oregon Health Authority funds some of those our primary audience, like, is through program elements. And I think a lot of the language we've talked about in terms of defining what prevention is and really wanting to assure that we're using the same definition. I think those program elements, we could do some work on the OHA side of making sure that the funding mechanism has symmetry and alignment to what our local prevention workforce is being asked to do. So I think I'm thinking about how, yes, I like this concept, and how can we intentionally ensure we're getting voice from the workforce, but also our funding, and making sure there's some alignment there. Thanks.
Yeah, so I do wanna just really quickly address one thing that I heard in that I think is interesting, that I think you that might stand to bolster the argument of, or might stand just food for thought, I guess, for a governance structure. The part about advising and having a conversation with OHA or any state agency for that matter around their standards by which they put money out, that's y'all's job anyway. That is y'all's job now, like with or without the Center of Excellence. And I think that's really important to recognize the role of ADPC statutory authority there. That's our role. And so regardless of whether we have a Center of Excellence or who the Center of Excellence is, maybe to even streamline that a little bit more, you would want more of that oversight role. That's just a thought. But right now, y'all have that power. Now with any agency, like that's an advisory role, right? And so we have to think about how that is all translated. But I just want to put that out as food for thought, that regardless of that, you all should feel empowered to have that conversation.
Thank you,
makes
Wes.
me have more questions, but I don't want to derail us, so I'll have. But that's really interesting. Thanks, Wes, and I'll dig more at that maybe with you later. Thanks.
And just kind of remembering too that we're not looking at a whole overhaul of OHA within primary prevention, but this is, what could the Center of Excellence, as far as a resource and helping kind of raise that awareness for all of our communities. So, let's see, Pam, are you still? I know you were next up, but I think you were having. Or do you want me to
Yeah,
pause on you?
can you hear me? I'm here.
Yes, we can hear you now. Yes,
Can
go
you
ahead.
hear me?
Yes.
Okay. Yeah, I'm in Portland, Maine, and we're having a thunderstorm and it keeps kicking me out. I'm curious, and maybe this is something that's obvious. What is the ADPC Prevention Committee right now? Are we a advisory? Are we oversight? Because right now we're focused on the Center of Excellence, but in my brain, I'm like, let's go back to basics. What are we now? And Wes, you kind of answered it, how things work. But are we an oversight committee? Are we an advisory committee? What are we?
So that is a complicated question. I can start, and maybe Annalise, if you want to get my back here. So you all advise the commission. So in that way, you are an advisory body. So you advise the commission. The commission does have more accountability structure to it. I think for the long period of history that the ADPC has existed, in practice, it has been more advisory. Excuse me. I'm sorry. That would have been confusing if I had said that. Um, uh, that does not mean that we can't look to a future where we start to provide more accountability on different things and ask for more accountability. Um, Annalise, that might sound perfectly unclear, but it is in practice how it works.
Yeah, and I think too, I noticed somebody mentioned this in their comments, which is very dead on and accurate. House Bill 2929 updated our statutes in order to kind of clarify this a little bit. And it now says very clearly that the ADPC role is to set policy for state agency and then hold those state agencies accountable to that policy. Now, does that mean we are the last word on everything related to substance use disorder in the state? No, absolutely not. We don't pass the laws in the same way, right? Like the governor can recommend a law, but the legislature has to pass it. So we're not the last word per se. But we do have that oversight and advisory function. So I think about the recommendations that we give to the governor, for instance, in terms of the budget, right? We really prioritize these things and they really need to get them in there. Then the governor makes that decision. Oversight, though, if we are charged with improving the strategy around certain funding streams, then that is something that we have oversight over. So like in the plan, for instance, we have set those strategies and now we have oversight with the state agencies to say, okay, have you done this, this, and this in the first 6 months? You didn't, why not, etc. So the committee is really doing the deep and dirty oversight work, I would say. You all have to, any action you're going to take has to go through the full commission, but that's really been the vision with the committees. So hopefully that helps.
It does. Okay. Yep. Thank you.
Okay. Thanks, Pam. Lindy and then Alexis, please.
Excuse me. I was just like viciously typing my notes before I forget them because I had so many thoughts. And of course, my sticky note just disappeared. One moment. Okay, so the first thing I wanted to comment on was around kind of piggybacking off what Jessica said and shared about the coordination with other funders. And I think I just wanted to emphasize that will be key, is really not necessarily that they can't continue doing their technical assistance and training and data supports and all the functions that OHA does offer for our grantees around in primary prevention, but that perhaps it's just more coordinated and aligned with the Center of Excellence, so that there's not duplication of efforts. Because what I could see happening is that OHA just kind of continues on doing what they normally do. And then there's this whole other body, and our practitioners and implementers on the ground are confused about where to go for support. And to me, it should be that both are resources, but the roles are really clear. And that if there is a training or any sort of technical assistance that they're providing, that it's really closely coordinated with the COE. Because, yeah, I mean, it's always good to have more capacity and resources, but I don't want our practitioners to get confused about where to go when they need support. And also, it's not necessarily like a responsible use of public funds to have duplicative efforts happening. So I really see them being complementary, and as long as there's that really strong coordination, which would have to be really baked into that contract. So that leads me to my second point about kind of the overall role of the prevention committee in that governance. I really appreciated all the comments that people shared, and I also support the prevention committee serving in that advisory role in regards to the COE implementation. I think the piece that will be important, for at least for me, is that there is transparency in the contracting process and regular updates and opportunities for engagement about the work happening. Kind of just built into our timeline as the COE is rolled out. So maybe every quarter, the ADPC staff who are working on that contract can provide updates. And eventually, over the course of years, there would be like deliverables that they're sharing about like the progress made towards those. And because sometimes I think with contracting, it starts to get behind closed doors, not necessarily intentionally, but just because it is so in the weeds and there's a lot of that financial piece of it. So if the ADPC staff can kind of break down some of those barriers to knowing how the work is folding out, that would be ideal. And of course, if there are concerns that the advisory board or prevention committee serving in that advisory have about what's happening, that we have a platform to share. But we can't raise concerns if we don't know what's happening with the contract. And then lastly, sorry, this is kind of long. But lastly, within the contractual objectives, I think there should be an evaluation component that touches on what Jessica shared on around getting feedback from the folks utilizing the COE. So how effective is the COE in doing what it's doing? I don't know what sort of evaluation has already been considered in that, but I would like to see some form of it that ensures the local practitioners are engaged in that, answering that question. And that is all. Thank you.
Thank you, Lindy. And I think just a little level setting, just to throw back to Wes. And maybe I'm misinterpreting, because I think all these comments are great and no feedback into previous work we've already done as far as when we looked at who did we want the Center of Excellence to help? What did we want to do? And I think, making sure with that this flows back into that discussion, Wes, because sometimes I kind of hear that maybe we're looking at not people thinking about that we're replacing a current system, but we, like Lindy said, kind of complementary in how that works. So, because we did do some heavy lifting up, that I think will help direct that. Alexis and then Tim, please.
Yeah, thanks, y'all. This is a great conversation. I think the only thing that's coming up for me is with either model, navigating transition. So especially the place that we're in now, where there are folks who have accepted their roles and are stepping off the prevention committee, just making sure how are we making sure work is continuing or knowledge base is continuing, or when we're recruiting new members, whether it's because of transition or just growing, how are we getting folks kind of on board with how things are set up or the mission of this, I guess, if that makes sense. So I think just kind of that transition planning piece. And if there's with either model, the oversight or advisory, if thinking about transitions, if one makes sense more under the other, and just what is going to be most effective, I guess, if that makes sense. So, yeah.
Yes, definitely. Thank you, Alexis. Tim.
Thank you, Debbie. So just thinking about the Center of Excellence itself, I would think that prevention would be in that advisory role. We have, a great number of subject matter experts from our behavioral health, our substance use disorder, our education specialists. We have some public health, prevention specialists, corrections, pulling that all together to be that advisor, which allows that flexibility with how we're advising situations throughout Oregon, from the frontier to rural to urban. And so we want to continue that flexibility with the subject matter experts that we have. If you look at the ADPC model right now, you have the commission, the full commission, and then you have the breakdown of all the different committees. I would hope the Center of Excellence, and I believe everybody in the room would want to see each committee, whether it be prevention or youth or other committees, also funneling their ideas and specialties into this Center of Excellence. So being that advisor would be perfect for the prevention. And that allows that next step to be the oversight. Other individuals with specialty around either politics or whatever that may be, whatever it would look like, to step in if the advisory committee and the Center of Excellence is not meeting its goal or meeting its objective, mission, and values. So that's how I would see that play out, which would also speak to Alexis, who said, what about some turnover? It was great outlined by Wes today with our specialists that are in this group, whether it be a commissioner or whether it be a school specialist and educator, holding those as that advisory role will make sure that we continue that voice going forward. And that's my feedback. Thank you.
Thank you very much, Tim. Anybody else?
Sorry,
Um,
Beth.
Let's go. Luis, let's go. You since I had a chance, and then we'll come back to you, Beth, if that's okay.
Yeah, just wanted to throw my 2 cents in. I didn't have a chance to do the homework for Wes, but I appreciate everybody's feedback and the advisory. I would like to see the ADPC Prevention Subcommittee, ADPC as a whole, as the oversight to full intent of HB 3321, because we are ADPC within ADPC and the ADPC Prevention Subcommittee, kind of leading the work of what the COE is. And the what I like about the structure of the ADPC and the ADPC Prevention Subcommittees is there are not that many layers. There's our subcommittees, the commission at large. Debbie is the chair. We have Annalise here to give us updates. So it gives us a lot of the transparency of the work that's being done and the conversations that are happening at a contract level, at an evaluation level, where if we are just the advisory, then another possible organization would have to hold those contracts that we would then have to ask them for contract updates and evaluations and things where it feels good to continue what we're already kind of building. The prevention subcommittees have different preventionists and voices in this group itself. So when we're asking for participation, we're really asking for that workforce of what we're hearing as well too. I think we want to hear from all different folks, and this is what I feel that the prevention subcommittee is, because we bring in different roles and responsibilities and different parts of the county or state of Oregon as well too. So I just want to, give my vote for the oversight and kind of keeping a little of the status quo until we maybe later on down the line see that, hey, it might benefit from somewhere else if they take charge of the contracts and moving that stuff forward.
Thanks, Louise. Beth?
Yeah, I just wanted to make a final comment after hearing everyone else's. And I thought people, Lindy in particular and others had a really smart idea. And then I don't know that we have in our scoping document about having the Center of Excellence be very connected to OHA and maybe even the Department of Education in Oregon. It seems like there's overlapping goals and missions of those different entities. And whoever becomes the Center of Excellence has to coordinate really, I think, very clearly with those other agencies and have some kind of synergy there. And I didn't hear us talking about it like that before, so I just wanted to highlight that. I think that's a really good idea and should be a critical piece. And it also has implications then for who has oversight and advisory capacity and what role, this committee plays or another, because if the Center of Excellence is connected to all these other entities, it's just another piece of the complex puzzle here.
Thank you, Beth. Louise?
To address some of the collaboration parts with OHA, but Wes, aren't we already kind of working on that with like the ODE prevention substance use committee?
I was going to actually bring it up a little bit, one more level. So yes, we are. Luis
Yeah.
is the answer to that question. Beth, I think you said it perfectly. That what you're saying raises questions about oversight, where you have multiple agencies involved with the need to align across those agencies on a given thing. And I'm not just going to limit it to OHA and ODE. Yeah, OHA is the big funder, but there are a lot of agencies who fund primary prevention in the state. And so not to mention ODHS, YDO, OYA to a certain degree. There are other things that are happening in this state, which I do think, to Luis's point, lends to a structure that has oversight capability over many of those agencies. Not all of them, but 14 of them. And I think that's really important to think about, because I think to your point earlier, who who else would do the oversight? That I think that's the question. If you move it to a single state agency, they have oversight over who they have oversight over. But do they have oversight in telling another agency what to do? No. I've been in that role before. It's really hard, actually. And so I do think that is an important point to kind of raise, is like that alternative vision. So if you do not see the oversight capability here, where else would it be? Will we have to develop a new board? Is that an efficient use of money? Like what does that mean? And so I want y'all to sit with that and maybe think about Beth's question about who else would do the oversight.
And Wes, I think maybe does that lead a little bit, Beth, to your kind of original thoughts, like, who would? And please, can you give us excuse me, a little bit more context on how you'd like us to answer that question without getting too, like, I say this organization, I oversee that. How would you like us to think about that? Can you capture that a little bit more?
Is that a question to me or to Beth?
Well, whoever wants, I think to you, Wes, because you just now brought it up when you said, who
Yeah.
do we don't not want to see, or
Yes.
how, as far as not calling out names or organizations, but maybe some of that structure that could be unintentionally derail it or make us go not achieve our goals.
Yeah, so yeah, I don't want to undermine and get into like who does the actual centering. I'm gonna say it like that. That's the verb for the center of excellence, centering. I'm not gonna get into that because we don't want to bias an RFP if we ever have to do one. I do want to say like where the money lands, where the legislature says, here's the money for this thing, go out and make it happen. That's governance. So that is an important kind of distinction to have in your head. So right now, what we're asking is you all clearly, I hear loud and clear advisory, yes. I think where we're really starting to kind of peel back is oversight, maybe depends. And so I think uh, what what there's a couple of ways this could go. Money could come to a specific agency or a university or another public body. It has to be somewhere that the legislature can allocate funds to, and then allocate the authority to put those funds out. There are ways in which that can happen, which would be when that money goes to that place, generally that entity has some oversight of capacity because they are stewards of public money. Other times, the legislature says, "Oh, by the way, we're going to add a board to this," and they write the rules for these things. So think the state board of education. They process all the rules. They make decisions at a higher level about what ODE does. And so that's another way to think about it. They have an oversight and accountability function as well. Then there's all this gray in between where the legislature could say, we want this body to advise on this thing, but we're going to give them money over here. What ends up happening is that even if they say this other entity has some oversight capability, they still have oversight capability with a kind of filter of the agency's interpretation of that thing. The more direct line you have in state government, so money, accountability, one stream through to a next contractor or to a next thing as it rolls downhill. So, for instance, the legislature provides rules and financing for local public health authorities. That money comes to OHA. OHA then sets the terms for local public health authorities within the scope of what they can. LPHAs hit to those, they meet the legislative design. That is like kind of the more through line of how funding and authority goes through. But when you start dividing it up across more horizontally, it gets really confusing, I will say. It also makes it really hard to coordinate. And finally, it doesn't always come out that you have this accountability that we're talking about or oversight that we're talking about. You have that to a degree, right? You have it on paper, but in practicality, it might not work out that way. So I just wanted to describe that in a little bit, just on the basis of the history of the state and how this kind of plays out in a lot of different ways. You all have served in some of these capacities before, so I think it's just really important context of like who else could do it to meet what you want to do.
Thank you. I think that helps us again kind of go for a full circle with all the work that we have already done and why these questions are so important. So appreciate that. Shauna, please.
Thanks so much, Wes, for that. It's really helpful to think about and to put everyone else's thoughts into context as well. I wonder, too, as we're thinking about the role of this committee in an ongoing way, if what the committee does in terms of advisory versus oversight may change during phase of project. And so I could see that, as you're saying, let's say that we're waiting to see where leadership or staffing lands, and maybe it does land at a particular agency, and that this committee serves as an advisory, a go-to group, a place to be, and maybe even more oversight during a period of transition. And then that handoff as staff step into place, step into that oversight role themselves. I mean, to Beth's point earlier of whether it be staffing where there is strong oversight that comes, and eventually that staff really becomes those who should be providing the oversight. And let's say that there are ebbs and flows where a particular agency is the lead oversight agency, and this this group is serving as an advisory and something changes, or that backbone can no longer serve as a backbone and there needs to be a transition or a change, and maybe this committee then is poised to step in and be a support during transitions, during unexpected changes. So I just wonder if it's not set in a way that this is it, this is what this committee does now forever in these ways, but there's some ebb and flow based on the needs of wherever that core staffing is living, or what their needs are in terms of support, where this committee may step back at times and lean in at others.
Thank you. Great discussion. I appreciate the deep thought that's going into all of this. And I really like when I see Wes nodding his head and I can just see the things going, yep, this is where it fits in. This is how it's all starting to become a reality. Anybody else? Thank you, Lindy. Thanks for being here the time that you could. Wes, before as you know, I often like to make sure if we have some members of the public, but I might need to save that for the end. How are we looking at for what you want to have accomplished today?
I think this is why I wanted to spend all this time on this, because I think it's hard. Um, I don't think we are quite clear yet on where we want to land on oversight. So this is what I would say. For folks who are more pro oversight, at least initially, and Shauna, I think that's great framing. I think we should think about this in a five-year time horizon. Let's not think beyond that. And so because I think a lot of things can change as the Center of Excellence matures. I think that third option in the second homework question makes a lot of sense, especially if you get really blockbuster, I'm not going to name anything, but like a blockbuster entity who's doing a wonderful job, and we have excellent mechanisms to collect feedback from our local partners, and they're saying they're doing awesome. There might not be, it might grow from not having the need to have an oversight organization within the state. Um, and it could just be advisory over time. So think about it in that short-term horizon. One, for the people who are pro oversight now, whether that be short-term or long-term, just remember and write that down a little bit more, think through that a little bit more. For the folks who don't think that the oversight should land with the ADPC or are skeptical, or just don't know, I really want you, and I challenge you to think who else could do it. And whether that should be an independent board, some other board, an existing state agency, how you would see that going, how you would have to articulate like how that would work with other state agencies and the interaction between the state agencies, us, the governor's office, the legislature. I think that's really important. And because I think that's the first question you laid out, man, that was a knockout. I think that's a really important thing for us to contemplate before we go further into this. Because I think we need to put all the options on the table. How does that sound? Okay, so light homework. I said no homework, light homework. But
Yeah.
I think the priority should be reading that report because we are ahead of schedule now. We're doing great. Read the report, and then so I'll send this email. Recruit, number one, read the report. Three, think about these positions with respect to oversight. I really appreciate it. Thank you so much.
Okay. This has been a very robust conversation, and I'm guessing that we might have members of the public that are listening in and might have some things that they would like to share with us. So, Ashley, do you have anybody that's written through the chat?
I have not received any written public comment through the chat, no.
Okay. So we are ahead of schedule in the meeting. I would like to open it up for public comment. Specifically as far as addressing what we talked about today. But then again, if you have something that you're here for and we're hoping to update or share the committee on, we open for that also. And we just request that you can keep your comments to 3 minutes if possible. So you can just raise your hand in the chat, or I mean, raise your hand on the screen. We'll try and do that. Wes, are you ready for us to take that down? Thank you.
Sorry, Debbie.
No, that's okay. I just wanted to make sure I could see the whole screen. Again, this time is yours. I'm not gonna make everybody sit around and wait for someone to talk, but want to make sure that the opportunity is available. And again, any committee members, if you're like, oh, I've already talked, but I still do have something to say, please. Thank you. For some reason, it comes, I see your chat, Jill, and then I get ready to read it and it leaves. Can you come off camera or off? Yes, go ahead
Yeah.
for it.
Yeah, no worries. I was just writing you guys independently about whether I would be a candidate to apply for a position with the ADPC. And it looks like Wes said, yeah, my current roles with the county shouldn't preclude me from being a candidate. So I would consider applying if you guys would find my expertise helpful.
Okay, we will make sure you get an application.
Okay.
Thank you. Anyone else?
Actually, I clicked on the link that was shared in the chat that takes the application. And when you read the prevention part, it does say it's not accepting. So I don't know if that will make people pause, but it does say that it's
Yeah.
not,
You're a
there's no
lifesaver. Thank you so much.
availability.
You're the first ones to see it. So that's just a typo from a previous iteration when we were full. Okay, so I'll make sure that
All
one.
right. Thank you. Okay.
Thank you. Thank you. Thank you. Thank you. Yes, we don't want people to think we don't have our stuff together. So, all righty. Okay. I'm gonna do the 1, 2, 3. I'm not gonna call anybody out today. I'm feeling generous. Okay, then Wes. Well, I am gonna call someone else. I have to do it. Annalise, as you sat there and listened to this, you don't have to be profound or anything, but how do you feel like as you guys work behind the scenes, that we're getting to something that could be really beneficial? Are we making the strides, do you think? This is not on your evaluation, Wes.
Yeah, I mean, I think I may have even heard a little more consensus than Wes heard today. I'm hearing you all have consensus around this, and I think what a couple things I'll add is, one, something that I think sometimes gets lost when you all are down in the weeds here. This isn't a either or that, as I understand it, the Center of Excellence isn't going to replace anything. This is really supplemental and really supposed to be the glue that glues it all together to really raise up the level, the quality, the evidence-based nature of primary prevention in the state. So it seems a little obvious to me. I think that of course you all would have a role in it, and of course the ADPC would, because again, this is just my assumption, you really want it to go across sectors and state agencies. You guys talk so much about that in the scoping, that you want to influence early intervention and home visitors and schools and supporting folks who are already doing the good work on the ground. So yeah, it seems like you guys are making good progress. I will just put out the thought that to manage expectations in this time of no money, that you know, certainly no one is going to ask us for a primary prevention package next year. And we can say, here's one thing you could fund. But another way to think about it is now that you have the idea, should funds become available, should there be a funding opportunity, maybe there's other, I think we've all seen the flood of new federal grants coming out. Like there might be an opportunity to fit this into without even having kind of wait for us what would be a 2029 legislative ask. So I'll put that out there.
Thank you, Annalise. And just one more person I'll put under stress. The rest of you can relax. Alvina, as our contractor, and seeing a lot of the things behind the scenes. I'd just love to kind of maybe hear your quick perspective as what you're learning on the back end, the benefit of this. Do you feel like we're kind of on the right track?
Hey, Debbie, I think so. And I think just the way that the committee has positioned itself, and these are the exact type of conversations we should be having, and using a lot of discernment, which is what I heard a lot in the committee. I think what I've always said and I've always appreciated about this committee is just we ask the right questions so that we can get to the right answers. And just having this conversation today in terms of how are we defining even advisory and oversight, and how are we differentiating between the two is just such a helpful step towards that right direction. So I'm really glad that we were a part of this conversation today. As always, we're flies on the walls, but it's always great intel for us. And just we're here to support the committee the best we can. But to me, it sounded like the exact kind of discussion that we were thinking about and anticipating. I also have my team member Lindsay Reeves here. Lindsay, I don't know if you want to jump in and share anything additional.
Thanks so much, Alvina. Uh, and no, I don't think that I have anything additional to add. I will maybe just put in a quick plug for the HIDA conference next week. Part of Alvina and I's role in listening to some of the conversation today was to really, build out the remainder of part of our presentation during that conference next week. And so we're really excited to have the opportunity to share a bit about the high level thinking of this group, how it's coming together in the Center of Excellence, and much of what we heard you all talk about today in terms of the connections back to House Bill 3321 and the work of this committee. And so really appreciated the conversation today, and I'm definitely looking forward to, Salvina mentioned, being back in the beautiful state of Oregon next week. So thanks so much, Debbie.
Thank you. All righty. Appreciate all of you that braved the open mic opportunity. So with that, I think we will give you 10 more minutes back to your day, extended lunch. Really appreciate everybody being here, and so grateful for the work that we have the opportunity to do. And again, a special thanks to Wes and Ashley who keep us moving forward. Ashley provides excellent notes, so we, people, we can kind of get that center back, and Wes again being our quarterback behind this. And appreciate all of you, and have a great rest of your month. Stay cool out there. Thank you.
Thank you, everyone.